So I think the principle is everyone is very, very busy, and there is too much of a time commitment at the moment for MDTs. And what we don't have is appropriate visibility of which cases are on there, what's the appropriateness of the cases that are on there. And so potentially, let's say that you have nominally an MDT where you've allocated time to discuss 10 patients properly. There'll be at least 15, 20 cases. And because you've not been able to appropriately case select the ones that you're going to discuss, it's almost taken for granted that case number 17 or 18, when you're really running out of time, is the one that you need to spend most time on. It's the most complicated. That patient needs all the time and effort when you're all tired. So part of it would be, how can we take the principle that we've talked about for imaging and do the same thing for all the other aspects of a patient's care? How can we do appropriate case selection? How can we make sure that we can prioritize which cases we discuss so that we use the times of the clinicians more efficiently? I think the main problem is that for institutions, because traditionally it was all paper-based, going from paper-based to suddenly having shared imaging PACS instances, and you can meet over Teams. Because what we've got is better than what it was, the people who don't go to the meetings don't really understand better than before isn't good enough, and there are better ways of doing it. And it's trying to persuade people that what we should be aiming for is using the best tech, which in its appropriate format. So you're putting some of these platforms, putting the different best suites, best solutions, all collaborate together. I think we focus too much on the hospital-centric care right now, but the main primary providers, the GPs, the community work, all they still get is an output, which is the report from the discussion. And we haven't really found a way to bring them in to the patient management, whereas they can bring the context for the patient. They're responsible for managing a lot of the social aspects, the day-to-day care. And if we can find a way of involving them widely in the region, that really would be best practice.